Medical treatment involves the use of four types of drugs. Antibiotics like fluoroquinolones and metronidazole treat perianal disease, for example, an anal abscess. Other three drugs like corticosteroids, infliximab, which is antibody against the tumor necrosis factor, and immunosuppressants like cyclosporine, 6-mercaptopurine, and azathioprine. These three drugs reduce the immune response and so lowers autoimmunity. Crohn's disease may require surgery when medical treatment fails, but in most cases, the surgery is done to treat the complications caused by the disease. Surgical intervention includes resecting the part of bowel involved, known as segmental resection, or proctocolectomy, or ileocecal resection. As the inflammation is in the form of skip lesions, therefore, when the segment of the affected inflamed bowel is removed and the remaining normal ends of the bowel are re-anastomosed, this is known as segmental resection. Since terminal ileum is the most affected part, therefore ileocecal resection can be undertaken. In case of an extensive disease, the entire rectum and entire colon are removed out, known as proctocolectomy. After which, the anus is anastomosed with ileum or a permanent ileostomy is carried out. Temporary loop ileostomy is undertaken when the colon is involved. In order to keep the colon rested so that it can heal, ileostomy is performed. A loop of ileum is brought out through a hole in the abdomen, in the interior abdominal wall. It is fixed to it, and then a communication is created between the anterior abdominal wall on the right side of the body and the loop. This creates a stoma so that the contents are excreted into a stoma bag and colon does not face any fecal material. It is then closed after the colon is healed. For treating the complications of disease, structuroplasty is done for strictures, abscess drainage, and fistula repair in case of perianal disease. In structuroplasty, we incise the stricture along longitudinal plane. Instead of suturing it back longitudinally, we suture it in transverse plane. This helps widen the area so now food can pass.